The reason I decided to go into research and become a principal investigator is that I was really interested and wanted to be able to bring some of the new, innovative, and cutting-edge treatments to patients and the patients that needed it the most. My experience is that the African American population views research quite similar to other populations. I think the thing to keep in mind is traditionally there have been some additional barriers that African American populations have been up against that have kept them out of research. But I think that a lot of those barriers can be overcome with our approach here at Headlands. I think it's extremely important for Headlands to be in Detroit. Typically, the folks in Detroit have been underserved and haven't had access to some of the treatments and innovations that are available with clinical research. It is extremely important for all people, particularly folks who have traditionally been underrepresented, to participate in clinical trials. If you're not participating, then people who look like you, who live like you, who do the things that you do aren't represented. So when we look for new treatments and better treatments, if people like you aren't represented, then we don't know that those treatments are as effective for you or as helpful for you. It's really something that you're doing both for yourself to make sure that you are included and for your community. A lot of thought went into the choice for location and our selecting this site. We wanted to be where people would have access to us. So the COVID-19 pandemic had a tremendous impact on research and the understanding of what clinical trials were and the entire process of developing new treatments. And I think it really brought it home to the general public, what it took or what was needed to develop new treatments and how important they were. When a new disease process comes along, what it takes to develop a treatment or a preventative measure and how important it is for that to be tested and make sure that it's effective and effective for everyone. So I think going forward, people are much more willing to participate in clinical trials, and it really gives us an opportunity to address some of the healthcare gaps that we've seen in the past, where people who haven't been included now can be. Here at Headlands, we're very cognizant, we're very aware of some of the traditional barriers that people have had to participating in research trials, whether it be ability to make it to appointments or travel, or whether or not they have difficulties with childcare or other access issues. We are very cognizant and willing to provide options to help to assist people in being able to access our site and stay in trials, whether that's having telehealth options so that we can perhaps do visits over the phone or in a remote way when that's necessary or appropriate, or assisting patients in getting to the site. I think the most important thing for people to know when they're deciding whether or not to participate in a clinical trial is to understand that you're not only doing a service for yourself in accessing potentially improved care or new treatments that may help to treat your disease or your medical issue, but it's also a service to your community and making sure that people like you and people who you love are all represented in these trials so that we can ensure that our treatments will be effective for them as well.